All right. Well, come on, we're almost done with today, so I'm very excited about this panel. And we've heard so much great information today, but it's just so pithy, really understanding why we do this and what it is that we're doing. But we're going to give you a little bit more concrete information of how you can do this, how you can make it happen in your communities. And this is about financing and infrastructure, but I was thinking about, is it like, how do we pay for it, show me the money, or follow the yellow brick road? So really looking at, how do we make this happen? I'm very excited about the panelists we have this afternoon. So as with all the other panels, I'm going to briefly tell you a little bit about each of the speakers and then turn it over to them, and really want to have a vigorous discussion before we all head out to happy hour. So really get into it. So I see this as a session of really innovation and innovative thinking, and how do we take everything that we've learned and really put the step on the metal to the pedal or what have you and get it out there. So we have Stephanie Lee, who is a senior research associate at the Washington State Institute for Public Policy, and that's a nonpartisan organization created by the legislature to carry out practical research on issues of importance to Washington. What's exciting about the work that they're doing, they're really developing these cost-benefit analysis models and tools and resources, and we're going to see it in action and really apply to some of the programs that you've heard about earlier. And so some of the tools that you can be using within your own communities, but really helping us think as a nation, how do we utilize more of these tools and resources to really take research to practice. And then we have Kathy Stack, who is the advisor for evidence-based innovation at the U.S. Office of Management and Budget, helping federal agencies to strengthen their capacity to use and build evidence to improve their effectiveness. Again, really restructuring and looking at innovative ways of funding, helping us to, across the federal agencies, really rethink about the way that we're bringing the funds to you to have a broader impact on the public's health, but really on the child health and well-being, but all of that work that we're doing. And looking at these innovative federal designs. And then we have Mary Beth Musomichi, who is an associate director at the Kaiser Family Foundation's Commission on Medicaid and the Uninsured, where she concentrates on Medicaid for people with disabilities, including issues related to people duly eligible for Medicare and Medicaid and long-term services and support. And again, we're going to look at Medicaid as an example and looking at that financing and infrastructure and looking really at how things are being paid for and how you can utilize that information to start to find the funding for a lot of these family-focused interventions.